Hello, and welcome back to our 4-part introductory webinar series on the UroDapter. In the second chapter, we will review how to use the UroDapter in female and male patients. There are a few things to do before starting the installation. In case of a new patient, we should check that the patient doesn't have a significant post-void residual urine in her or his bladder. This can ideally be done with an ultrasound after urination. If we do not have access to an ultrasound, residual urine can also be checked using a single-use catheter. Ruling out significant post-void residual urine is only necessary once as an initial step and doesn't have to be repeated before every installation. Therefore, once we have ensured that the patient doesn't have residual urine, we can simply ask them to empty their bladder to the toilet before installations. We should attach the UroDapter to the syringe filled with the medical solution we want to instill, and finally, we should properly disinfect the urethral orifice. And with this, we are ready to start the installation. To easily understand the installation process, we will use some animation videos starting with female patients. And you can also find these videos and the detailed step-by-step instructions and guide at the app.urodapter.com website. First, we need to make sure that we have a visual access to the urethral orifice. In case we are right-handed, we can use the fingers of our left hand to achieve this. And we can also gently position the urethral orifice a bit downwards under the symphysis toward the rectum. And this is important because if we try to push anything to the urethra, let's say the UroDapter, a catheter, or an endoscopic device, just straight forward, then we might reach and push to the symphysis of the pubic bone. And this is, of course, unpleasant to women. And furthermore, it also blocks the free flow of the instilled solution. Then, for the same purpose, as we insert the UroDapter in the orifice, we gently drive the syringe with a spooning motion under the symphysis. Doctors or practitioners performing regular female catheterization or cystoscopy are familiar with this spooning motion, as this is necessary to bypass the pelvic bone. After the spooning motion, the UroDapter and the syringe should be parallel with the urethra. This optimal angle will cause the least resistance and easy flow of the solution while pressing the syringe. However, the proper angle to get parallel with the urethra might be depending on the pelvic anatomy of the patient, which typically relates to the patient's age. As a general rule, for younger patients, the optimal angle might be a bit upwards, meaning that the tip of the UroDapter is situated slightly above the syringe, whereas for older patients, it might be a bit downward. It is important to ask the patient to relax her pelvic muscles. The urethral sphincter must be relaxed to let the solution easily flow into the bladder. The UroDapter must be positioned in the urethral orifice with the necessary force to provide a watertight closure of the urethra and avoid leakage. Inexperienced users might be afraid from this and might try to use the device without the necessary subtle but firm force. But this will result only in an inadequate closure of the urethra and possible leakage. Therefore, correct positioning of the UroDapter is very important. Use the spooning motion to get under the symphysis, adjust the angle to be parallel with the urethra, and press the device firm to the urethral orifice to provide watertight closure and avoid leakage. After positioning the device, we can start the installation by slowly pressing the syringe. In case we position the UroDapter correctly, we should be able to instill the liquid without applying heavy force to the syringe or feeling a major resistance. Of course, there is a chance that our initial positioning was not ideal and we didn't find the optimal angle. Therefore, once we begin to slowly instill the liquid, we should always adjust the angle of the UroDapter and the syringe until we feel that the fluid flows through the urethra with the least resistance. During proper instillation, the instilled solution will increase the intraurethral pressure above the sphincter pressure and will completely open the already relaxed sphincter, allowing the solution to easily flow into the bladder. This amount of pressure in the urethra is very similar to the pressure we create during spontaneous urination and doesn't cause any harm, damage, or problem. If you feel that the patient is tense or anxious and cannot relax her sphincter during instillation, just slow down or pause the instillation. Instruct the patient to take a few deep breaths and relax her pelvic muscles and sphincter. Resume only when the patient relaxed her sphincter. Remember, during proper instillation, the instilled solution will flow through the urethra easily without any major resistance. After the instillation, simply remove the device from the urethra. Some minimal, insignificant leakage may occur after the instillation, but it's usually just a few drops. And with this, we completed the instillation process with UroDapter in female patients. In male patients, the instillation with UroDapter is very similar to female patients, with a few important differences. The first step is also the correct positioning of the device in the urethral orifice, providing watertight closure. In male patients, it is very easy to position the UroDapter and the syringe parallel with the urethra. By starting the instillation at low speed, we should feel the solution flow through the urethra without any major resistance. Just like in female patients, during proper instillation, the instilled solution will increase the intraurethral pressure above the sphincter pressure and will completely open the already relaxed sphincter, allowing the solution to easily flow into the bladder. The amount of pressure in the urethra during instillation is very similar to the intraurethral pressure during spontaneous urination and does not cause any problem. Slow down or pause the instillation if the sphincter is still constricted. Instruct the patient to take a few deep breaths and relax his pelvic muscles and sphincter. Resume only when the patient relaxed his sphincter. A very important difference between female and male patients is that the male urethra is much longer below the sphincter. This means that by simply instilling the liquid from the syringe, a significant portion of the instilled solution remains in the urethra, which would be lost after removing the UroDapter. To avoid this and to deliver the whole amount of drug solution in the bladder, the two-step process must be followed in each male patient. After complete instillation of the solution, compress the urethra below the orifice by 2 fingers and remove the syringe with the UroDapter from the orifice. While keeping the compression of the urethra, fill up the syringe with 20 ml of air. Reinsert the syringe with the UroDapter into the still compressed orifice and ensure its complete sealing by the isolating collar. Release the urethral compression and push the air slowly into the urethra. The instilled air bubble will push the remaining liquid into the bladder. This small amount of instilled air is completely harmless and will be emptied with the first urination after the instillation. Please remember, you can find these video animations and the detailed step-by-step instructions at the app.urodapter.com website. Thank you for your attention. In the third chapter, we will continue with the most important indications for where intravesical instillations are used in medicine and where the benefits of the UroDapter can be utilized.